Okay, there we go. So welcome everybody to our session on library resources and services for veterans. We're joined today by Loretta, Morgana, Rachel, and Greg. All of them will give us an overview of the many resources available to veterans in our communities, and hopefully you can learn from them how you can best connect the veterans to the resources that are available. There's lots to talk about. I'm sure this is just the beginning of this conversation within an hour. But we're so glad that you agreed to come and talk to us about the resources. So take it away. I think Loretta, you're starting, right?
Yes. So I'm going to
Okay.
start off today. There are four of us presenting, but my name's Loretta Grickus, and I'm the clinical librarian at the White River Junction VA. I'm a solo librarian, basically, in a sort of a virtual service, and I'm a special librarian, like a clinical librarian. But I'm also working on an outreach project, and the project is intended to connect. Uh, Public libraries in our catchment area, which is all of Vermont and then the four westernmost counties in New Hampshire, to the VA and to resources in the VA. And we're very, very grateful and appreciative to be able to speak with you today. So the project that I'm going to talk about and that I've been working on has to do with eligibility. That's how it all started out, but it sort of evolved from that. And there was a Veterans Town meeting about a year ago, prior to coronavirus. And the problem that was identified at the town meeting by a veteran was that, there's a lot of people that are veterans that don't realize or think of themselves as veterans because they were never in combat. And they might not even realize that they're eligible for VA benefits. So reaching these people can be difficult, but we thought that maybe public libraries might be a way that we could get through to them. So our catchment area, once again, is all of Vermont and the four westernmost counties in New Hampshire. And what we did was put together information packets. And I have maybe spoken to some of you already on the phone. They look like this. Let me see. I'm trying to maneuver. Are you able to
So
see it?
Loretta, if you have your background on the Teams
Oh,
background, it doesn't show. It kind of cuts that out. So it'd probably be best to turn that off.
okay. Well, for the time being, I'll just keep going and I'll try it later.
Sure.
But it's a
Okay.
it's a folder that has a number of different items in it. A brochure outlining the program. There's an eligibility brochure that provides local numbers so that people can get in touch with someone right at White River Junction without having to always call a national number, which can be frustrating. There's information about the vet center and the mobile vet center, which Morgana will talk about a little later. And there's a lot of information about telehealth. There's a booklet outlining all of the potential VA benefits. It's really a great resource. And in addition to that, we have a letter that goes in each box, and we're sending a box with several folders to each library in our area. And the letter outlines the whole program so that everything I'm telling you today will be in that letter. And then also a tip sheet for library staff with all different numbers so that if staff get questions about the program, they have the number of someone to contact at the VA. And my number is on there as well. And anybody can contact me at any time. So we wanted to make this as easy as possible for public librarians. And so we didn't want anyone, especially in a solo library or a small library, to feel like they had to approach anyone. So we created a very nice poster as well. And the poster says, "Did you serve in the military? Ask your librarian for an information packet." And that way, a patron that served in the military or is a veteran can come in to the library, see the poster, and approach staff. And you can keep the folders anywhere you want them, in a desk drawer or out or what have you. We realize that with the pandemic, most places are either closed, open very limited hours, or doing curbside. So we're just in the process of sending the information to all of you. We're about halfway through sending the information out. It's kind of slow going because I'm doing this, in addition to my regular work, little by little. But we've reached already all of the 4 counties in New Hampshire. That went extremely well, in about half of the counties in Vermont. And so I expect to finish by maybe late spring or early summer, late spring really, probably May. So I've been calling every library ahead of time and just touching base with the librarian and, leaving a voicemail if they're not open, and explaining the program. And that's led to a lot of nice discussions with many of you. And then the materials are sent either by mail or by the courier van. The state libraries have been wonderful, both in Vermont and New Hampshire, in delivering the information to each of you. So that's basically, in a nutshell, what the project entails. It's led to some wonderful things. Greg Hartford is going to be next, and will tell you a little bit about a project that came out of this project. So Greg is with the business office at White River. And Greg, if you're ready, you can take over from here.
Thank you so much, Loretta. And thank you, everyone, for your time today. I'm really excited to be able to talk with you all. As I was reading my son to sleep last night, I told him excitingly that I was talking with all the kind people who get us all the books we read every night. If it wasn't for our local library during this pandemic, we really wouldn't have a constant source for us. So as a family, we were so appreciative of all the curbside pickup at all local libraries. So thank you all. So as I already mentioned, I'm the chief of the business office here, and one of our main missions is enrollment and in our outreach efforts, throughout the state of Vermont and our counties in New Hampshire. I wasn't aware of the project that Loretta was doing. As I'm new here, she was quietly putting this together and working so hard to reach out to everybody. And we're so appreciative of her work, and the fact that all the libraries in our area, catchment area, have been so receptive to this project. One of the largest hurdles, especially in a area, as rural as this, is getting the information out to our area veterans, and letting them know that they can call us directly. They feel, especially when you get, some of the older Vietnam veterans, they feel that it is a large process, it's complicated, but we really have a fabulous team here at the White River Junction VA Medical Center. Both Jenna and Tiffany, who work in the enrollment office, they work tirelessly, and we receive, especially during COVID, we've had a fairly large uptick in our enrollment, mainly based on the fact of the economy. And as the economy has taken a hit, a lot of veterans are applying for VA healthcare. For us, for enrollment, it's wonderful, but there are a lot of veterans out there who don't know how to get into our system, and they don't have the information to contact us. So it's really that main contact that's important. And we're always, we're here 8 to 4, sometimes longer, everyday processing enrollment. So we're so happy that this information can certainly get out to the community. So thank you all once again. Now, a lot of veterans looking at their healthcare enrollment, it can be complicated, which is why I'll go over some of the basics of what we look for when a veteran is going to enroll in VA healthcare. One of the first pieces is we're going to look at their active duty service, and we're going to look at their character of discharge. Now, a lot of veterans do have their discharge document on file in their homes, which is a DD-214. That is probably the most important document that we need to quickly enroll a veteran into healthcare here. There's going to be some other factors we're going to look at as far as enrollment goes. There are specific special treatment authorities for Vietnam veterans who served in country, boots on ground in Vietnam, veterans who served at Camp Lejeune from the 1950s to the 1980s. Most of those were Marines, and veterans who served in the Persian Gulf. So there really is a lot of detailed eligibility factors that my team is well trained and versed to look at. We also have access to some programs to draw in military personnel records for veterans who don't know if they're enrolled or don't have their DD-214. So we really will do everything that we can to ensure we're pulling in all the documentation we can to make the enrollment process as seamless and easy as possible. So there's a few ways where they can contact us. In this chat, I'm going to add my direct number and extension, but they can also come in to the hospital here and see the eligibility staff, which are located in the Mountains building. A lot of you have seen our contacts are in the eligibility brochure that Loretta had put together in the informational packet. So they can come in, and really it's a quick process if they do have their DD-214. We can enroll them within 20 and 30 minutes. They're going to fill out an application. So that 1010 easy, we're going to give them that form to fill out when they come in. Or if they need a copy of that form, they can certainly reach out to us. But the most important thing I tell everyone when we talk about outreach is if they have a question, to call us. If they know a veteran who wants to get into healthcare, call us. And if you can't get in touch with us, I'll be adding all of our, we've put in the informational packet, the email addresses, but I'll also put in mine. We are triaging all of our incoming, enrollment requests. So all the information that Loretta put together is going to be a great starter to get in touch with us. So, it's really important that veterans who feel they might not be eligible know that they can reach out to someone who can help. Now, with those informational packets and getting out to the libraries, we also have a wonderful project right now that we're planning at the South Burlington Library. And as many of you all know, and most of the libraries across Vermont, I believe all of them, someone could correct me on that, has high-speed internet. Maybe not all of them, but most of them. So the South Burlington Library, which is being planned right now, we're currently looking at a project where if a veteran could not get down to us, we could have them schedule a telehealth appointment at their local library. We would have a veterans outreach specialist with one of our local groups go and meet that veteran and get that appointment set up in one of the private rooms at the South Burlington Library. This project is currently being planned, but as we've gone through, we really believe that it's going to come to fruition. It's going to happen, and I think it's a wonderful collaboration between the Department of Veterans Affairs and our local library system. We just want to make sure that it is a distance from here to, so a lot of veterans who can't get here, veterans who may be homeless, veterans who don't have transportation for whatever reason, or maybe may not be able to jump in the car and get down here due to whatever reason. We want to make sure that there are resources out there where they can have a telehealth appointment in a safe space, and libraries, as we know, are safe and wonderful places, and we certainly are very lucky that the South Burlington Library is really receptive for this plan. So again, I'm going to put all of my contact information in the chat. If anyone has any questions about enrollment and eligibility, I want to reach out directly to me, and I will get back to you fairly quickly. Next up is Morgana, who is the outreach specialist at for the VA at the vet center, and she has some more information for you.
Good afternoon. So I'm Morgana Eisenberg. I am the VOPS, which is the Veterans Outreach Program Specialist, as well as the Mobile Vet Center. I cover as the outreach worker Vermont and New Hampshire. And then with the Mobile Vet Center, I actually cover all of New England. So what we do at the White River Junction Vet Center, or any vet center, is we provide readjustment counseling for combat veterans, military sexual trauma, bereavement, those who worked in mortuary affairs. And just recently, because of COVID, we have opened our eligibility to those in the National Guard reserves that are working the COVID sites. And resources like that are eligible to come to the vet center as well. So, sorry, a little nervous here. So we are a partnership program of the VA. And the difference between us and the VA is, one, we don't provide medical. So you're not going to come and see us for your nose, ear, throat, anything of that sort. And two, our records are actually held separately. So I have access to the VA records. The VA does not have access to our records. So we are a safe place for active duty, Guard, Reserve to come and get their mental health. With the Mobile Vet Center, so it's a 38-foot Freightliner. Probably see it once in a while I drive it around, big white truck. With a big eagle on it, says VA Vet Center. So that's actually a FEMA vehicle as well because of what is on that vehicle. So it actually has 2 private counseling offices on board. So if I'm out at an outreach or out in a rural area seeing veterans, if we needed to, we could go into a private office and talk about what their needs are, what is going on, things like that. I also have a shower bathroom for homeless vets if we were at a stand down and they needed to use it. I also have a satellite generator, which also helps with the FEMA part of it, is because I have all access to anything internet wise. I have telehealth capabilities, so I can actually help a veteran or their veteran's family member speak to another vet center or another VA facility face to face. So I could actually get them set up with appointments as well, any other resources they may need as well. At the vet center, we actually have, I host a weekly free curbside farmers market every Wednesday, 10 to 12 p.m. And it's open to everyone, not just veterans. We help the community as well. We believe in giving back. We also have a RAP group with Wellness Recovery Action Plan. We have a creative expressions writing class. We have a women's reading group, which was focused on Brene Brown's Daring Greatly and Rising Strong, which was very successful. And soon, hopefully, once COVID gets normalized, when we can use outside, we will have our Star Stripes and Strings guitar group. A drum group will start yoga again, and we're hopefully going to start a meditative movement, Qigong, I believe it's called. And then we're going to have an OIF, OEF group as well, hopefully anger management group as well, things of that sort. I'm also going to put my contact information in the message box. And that's about it for us here at the Vet Center. We also have an outstation in Keene, New Hampshire. We have Rutland, Castleton area, Plymouth, New Hampshire, Randolph area as well. And then we have the South Burlington Vet Center as well, which they have multiple outstations. We also have the call center, which is run 24 hours a day, 7 days a week by combat veterans and their families. So it's not a crisis line, but it will get you in contact with any vet center in the United States. So if a veteran was moving to, say, Alaska, all they would have to do is call the combat call center, tell them where they're going, and they will connect them to their closest vet center. And they also, if they feel like you are in crisis, will do a warm handoff to the National Crisis Line or the National Caregiver Hotline as well. And that's basically all it is here at the vet center.
So next up, we have Rachel Hayes. Rachel, if you're ready, we're going to hear from Rachel Hayes, who is going to talk about healthcare for the homeless.
Hi, everyone. This is Rachel. I am a social worker on the Healthcare for Homeless Veterans team. I am based out of White River Junction. Just for a bit of a background, I cover the Windsor and Orange counties in Vermont. I cover the lower portion of Grafton and Sullivan counties over in New Hampshire. And I also work in our HUD-VASH program, which I will get to in a moment. So essentially, the Healthcare for Homeless Veterans team, what we do is first, when we meet with veterans, just make sure that they are enrolled in services through the VA, which I know there's an awesome presentation about the eligibility portion, so I won't go too much into that. That being said, so for VA eligibility, the portion that we look at for that is that they might be deemed veterans could utilize the HUD-VASH program. Essentially, the HUD-VASH program is a partnership between the Department of Veterans Affairs and the housing authorities per each state. So typically what we work with is Vermont State Housing Authority and New Hampshire Housing and Finance Authority, where veterans are allotted and this is typically for veterans who are deemed chronically homeless. They are enrolled and allotted a Section 8 voucher and a case manager. So it's, they have a clinician that they can kind of refer to. The HUD-VASH program is available in all parts of Vermont, all counties in New Hampshire. The White River Junction portion just also covers those western 4 counties. So that would be the HUD-VASH. We also have what's called a grant per diem. That's a transitional housing opportunity for veterans who are, I won't get into the nitty-gritties about eligibility on that, but that is something that we can kind of help maneuver if they're qualified for a grant per diem stay. And for folks who are not deemed eligible for care, and for folks who are, we have other community-based options that we frequently utilize, and we also work with them. So one being what's called a supportive services for veterans and families. The 3 main ones that we have are Veterans Inc. SSVF, which is located out of Bradford. There's also a grant per diem house in Bradford in the same location called Veterans Inc. SSVF at UVM also, they are based up in Burlington, but they have case managers in both programs that cover the span of the state of Vermont. And over in New Hampshire, we use Harbor Care. So that is an option. And we also have one shelter that is contracted with the VA. So that would be Open Door Mission out in Rutland. That being said, there are social workers who work at every single CBOC. So we have a social worker, at least one, designated to all counties in Vermont. So my counterparts do outreach and myself to local shelters, food shelves, and just kind of looking for, anyone that might have any questions. We can help with any eligibility questions, get folks connected to services. Just kind of stressing that there's no wrong door for any questions that might pop up with homeless veterans. If we're not able to help them under the umbrella of the VA, we can help them out in the community too. We have it's a larger process, but it's called the Continuum of Care. So the Continuum of Care, they are monthly meetings that occur in each county in Vermont, where providers from all over the communities come together. So oftentimes it's shelter staffs, a representative from the VA, local hospitals. In some of the COC meetings, there are librarians that do attend because just for basic resources too, since homeless veterans do sometimes and hang out at the libraries. So there's no wrong way to make a referral. So what you can do if you do stumble upon someone who's experiencing homelessness, has any questions regarding their housing, you can feel free to refer them to a local VA clinic. So we have the clinics in Bennington, Rutland, Burlington, Newport, and White River Junction and Brattleboro. If somebody has more of an immediate question, there is always the Vermont 211 option. 211 is available in every state. That sometimes is just for folks if they are immediately needing help. So just as a little bit of an option. And also collaborating with the local shelters and food shelves. These are just through the what's called the coordinated entry process is just how we identify homeless veterans within our communities and try and gather enough information to at least put them with the services that best fit their needs. So for example, some folks might benefit a little bit more from an SSVF program, which the Supportive Services for Veterans and Families. Those programs can help lower income folks with security deposits when they're moving into a new apartment. If somebody's literally homeless, they can help with the housing search. And I know during COVID, economic services around the state and SSVF programs were able to put veterans up in hotels too for immediate shelter options. So those are kind of the biggest ways that we identify. We do a lot, as I had mentioned earlier, we do a lot of outreach. We are community based, so we can go out and meet veterans either in homeless shelters, in their homes, once they are enrolled in a program. For HUD-VASH, for example, they stay enrolled in the program for typically around a year or so. So we'll conduct home visits, make sure that their home is safe and that they're doing well in the environment. And we can really essentially meet anywhere. We have proper PPE now. It makes it a little bit easier. We also are able to do telehealth. I know for some folks living out maybe a little bit farther out in rural communities, telehealth is a little bit difficult, which I think is beneficial when we can actually travel to them. It is helpful to actually kind of meet face to face and do some things paperwork wise, get everyone connected. And once folks are housed, because we are a housing first model, we can often help, and even during that process, just make sure they're connected to other resources such as healthcare, additional mental health services, if folks are needing, help with Social Security, finances, anything along those lines we can help with. And I did, and I'm going to actually put this in the chat. I think it might be a little bit easier. I'm going to put my contact information. I would just encourage if any questions come up, I'm always so happy to send out resources. It might be a little bit easier. Folks can actually see the resources. And we have a general hotline for homeless veterans, which is an awesome hotline to utilize because when you call it, you get a person. But then it goes directly to one of us based out of White River Junction. If the veteran is calling from anywhere in the state of Vermont, someone from the VA itself will give them a call back and assist them with, whatever immediate housing opportunities that, what they need help with. And if folks are able to, like I said, there is someone stationed at all of our outpatient clinics that can help with any homeless walk-ins that occurs where folks can just walk into the hospitals, say they need help with housing. Someone from our housing team can help with that and help connect them to those services. So I will put that number in the chat too, along with my contact information. And I wanted to kind of keep this presentation brief to allow if there's time for questions or anything that I might be able to help with.
Thanks, Rachel, and everybody else. And Loretta, I see that your background is off. Did you want to show really quickly the folder?
I would
Okay.
be happy to.
Yeah.
So this is, and let me know if you can't see it, what one of the folders looks like.
Yep.
About half of you have gotten them. The rest should be getting them probably in April to early May. And inside there's a brochure that we put together, and all of this is done at, was done pretty much at White River Junction, and has White River Junction contact information for the most part. There's a veteran's guide to eligibility that has local White River Junction information. There's information about the vet center that Morgana talked about. There's something called My Healthy Vet. There's information about how veterans can get to their health record and their health information, and a book here that has Your Benefits Are Commitment, that has all of the various benefits that somebody could be eligible for. The main thing I wanted to show you is the poster, and this was the poster that I had mentioned. I don't know if you can see it, but it's we have it in a large and a small size. And so what some places have been doing since you've been closed, to the public, is putting it in facing out in your outside window, so that people come up for curbside and they see it there. And I've heard a few libraries say that that's what they've been doing. Just one last thing I wanted to say is, and Greg mentioned this, but we're so happy with the response from the libraries that we've contacted so far. It's been wonderful, and everybody's been great. I was a public librarian before I started working in healthcare libraries for 20 years, and I respect and appreciate everything that you all do.
Thanks so much. And we have Jason Broughton, our state librarian, in this session today, and he's been asking a lot of really great questions. We also have Michelle Carver of the VFW. And Michelle, I think you're in Burlington, if I remember correctly, also responding to some of the questions from her perspective on that Jason posted. So let's start with those first. So Jason had asked, in your opinion, what reasons do you feel stop veterans from seeking out services and benefits? Michelle offers mistrust of the VA systems, frustrations related to filing VA benefits claims, not enough education established while military members are in uniforms. Better partnerships between the military and the supportive services offered to veterans will prevent many of the ongoing struggles we can point to today. Thanks, Michelle, for that. How about our panel? What do you think is preventing folks from seeking help? Greg.
So as our office really sees these veterans when they first come through the door, we're the first face of the VA that they speak to, and all across the country, I've spoken to other business office managers who have repeated the same thing. So many veterans, especially in the now the Vietnam or the World War II era, feel that by going to the local VA hospital, that they're taking services away from other veterans who need it, when in actuality a lot of them don't realize that the more veterans that we have within our system, the more resources we can allocate for our patients, for our veterans. So that is, I feel, probably the most prevalent issue that stops them from coming in. And when they realize that their enrollment and really the extent of services that can be offered here and the quality of care, especially at White River Junction, is so fabulous that a lot of them feel that they immediately tell whatever friends they have that are veterans that really go down to our office and get enrolled. So really, a lot of veterans need to know that there are three core strengths that distinguish our services from the private sector. And that's really, system-wide clinical expertise regarding service-connected conditions. And those could be, injuries or diseases that the Veterans Benefits Administration has been deemed that veteran has due to their service. So our clinicians really are well versed, and that's what they see day in and day out. So they really understand those injuries from service. Also, we offer a team approach to primary care that is truly veteran centric. So all of the providers can see that file. There's not multiple providers over different, facilities that have to kind of put together that healthcare picture. So it's that team that's really looking at, that veterans. Whatever that veteran's there for, to come out with the best outcome, long-term outcome. And the third piece is really, we have a holistic view of the veteran that includes physical, psychosocial, and economical determinations of health, including critical support services for family members and caregivers. So I think once the veterans come in the front door, which is why I, before when I spoke about the importance of just getting in touch with us, and once we get veterans in the front door, they really are truly amazed at all of the services that we offer. But certainly I saw, Michelle respond regarding the mistrust of VA systems. But for our area, I think that's changing. The more veterans we get out through our system, they trust the White River Junction VA Medical Center. All the veterans who are walking out the door that are either speaking to me or I've helped enroll them, they really love their care here because we, this is a really kind and compassionate workforce here in White River Junction. So we really push that trust piece and ensure that when the veteran's leaving, they ensure we're looking at every piece of their health care to come out with the best outcome. Now, I do understand that there is a miscommunication between, when the veteran is leaving the military and how they can access VA healthcare. The VA has groups that are specifically stationed at bases to assist in that out processing, that are giving those veterans all of the information they need. Now, some veterans don't. They may not attend those classes. Most now are forced to attend those exiting classes. And that's why we've really ensured that, whenever a veteran is getting out, we like to get them in as quick as possible, because there are certain eligibility factors that come into play with VA healthcare enrollment for a veteran who's getting directly out of the military. And really reiterating it, the conversations or statements that would be help veterans to come see us really begins with, the first faces they see. And that's at this rate, we're talking about the librarians who have that information at each facility. And it's so important that, you guys are able to connect them with us so we can give them the accurate information about their enrollment and ensure that we do explain to them all the services that we do offer here.
Thanks, Greg. And that's actually a perfect segue to Jason's second question from a library point of view. So Michelle has offered a more strategic answer to Jason's question, but at the ground level, Jason wants to know what conversations or statements would be helpful to encourage veterans to seek out this information. And I'm assuming that's, if I'm staffing my library and I see somebody that I think might be a veteran or that I know is a veteran because we're in small towns and we know such things, what would be sort of the openers or the icebreakers to say, hey, you ought to really talk to those guys in White River?
I think with a lot of the veterans that I speak to every day and going through the initial conversation is after a veteran is, actually reaching out, we of course go through all of the services that we offer. But the important part is, they've served their nation. And this is a brick and mortar, the VA is a brick and mortar promise to them if they are eligible, that we will take care of them in their health care. So the largest piece, for us is really talking about the cost of private health care. I mean, we all know what that cost of private health care is. And And, if we can get a veteran in here, the cost really is minimal once they are enrolled. So the cost piece is, I think, really a driver for a lot of veterans to reach out for VA healthcare.
I have another something to add as well to what Greg was saying. In with the box that you'll receive with the folders for library gateways is a tip sheet for library staff, and you might want to leave one of these at the reference desk or at your service desk, because it has all of the local numbers, and that'll be you can either give it to the veteran or just have them write down whatever numbers. But librarians are always welcome to call me. My number is on the sheet, and I won't necessarily have the answer to the question, but I'm a librarian, so I'll know, how to find the information and how to get you to the right person. So feel free to, to just think in terms of locally, who can I call, from the sheet at White River, and one of us will get the veteran to where they want to go.
Great, thank you. Joy asked about the program in South Burlington. So if that program goes well, is there a chance that it would expand to other libraries? That's the telehealth program we're talking about. I think that's a great question.
One thing I could mention is that, we're still working out all of the details for that. We meet once a month and talk with Jennifer Murray, who couldn't be on this call. But what we're finding is that it might be simpler and it might be, more achievable than we thought. And so, we're certainly sort of using this as a test or a pilot, and to see how it goes. And we have hope that it could work out very well.
Yeah, and from our perspective, when we heard about this program, we talked amongst ourselves because we thought it was really great. And we also know that some libraries offer rooms that are multi-purpose, for instance, to help with with DCF for family visits, for supervised family visits. And who knows, there might be an opportunity to kind of double dip in those rooms. And when they're not used for family visits, of course, when we're back in business again, but when they're not used for those, as long as they have a high-speed internet connection, there's some privacy to maybe use them for telehealth appointments. So I think COVID has forced us to be creative on how we use our spaces and helped us to be maybe a little bit more flexible and not overthink things like how do we pull telehealth off. So that's just something for you all to think about, is that libraries have other spaces that they're already using for purposes. And again, I don't want to offer those spaces, but maybe there's some way to connect those up. So thank you for that. Let me go down the questions. We're very excited about the mobile unit. That sounds really amazing. And again, there might be some libraries that would be very happy to host. And Joy suggested that maybe it could be a collaborative effort where a few local libraries could share the hosting of the mobile unit in maybe the library that has the biggest parking lot. I've seen the unit, I saw it at CCV before, and it takes up a lot of parking spaces, but we have a lot of libraries with big parking spaces as well. So that could be a possibility. And Morgana, if you want to be in touch with us to help you maybe facilitate that, we're happy to.
Absolutely.
Let me see. Great. And
I did see a question from Jason
yep.
about, does the program assist those who have dishonorable discharge and less than honorable? I didn't mention that at the vet center, our services are free to the service member, the veteran, and their families. We also see families and children, and that our services are also provided regardless of the nature of the veteran's discharge. So this includes services to those individuals with problematical discharges, dishonorable discharges, and things like that.
Greg, go ahead.
So to to be eligible for VA healthcare, you do have to have, honorable discharge or general. We have a program that I'm trying to essentially expedite a request to have the character of discharge reviewed by the Veterans Benefits Administration. So, Jason, we can, if a veteran does walk in and look at that information and says, I have a dishonorable discharge, that is not a halt, as Morgana had mentioned, they can receive care at the vet center. But as far as healthcare goes, our enrollment office is trained to immediately contact me. We're going to try to draw their service records in, and we're going to talk to a specialist at the Veterans Benefits Administration. Here, the regional office is on site in White River Junction. I also have some contacts at other regional offices throughout New England if I need to expedite that character discharge determination. At that point, it gets technical as far as the reasons why a veteran was listed as dishonorable. But I will have to say that we are getting quick turnaround. So if there is a veteran who's got a dishonorable discharge, we're trying our best to ensure that they are, it's called, written in for veterans healthcare benefits or service connection through the VBA.
Great. And Jason, you have your hand raised. Go ahead.
Thank you. Hopefully you can hear me. I really appreciate all of you being here today to discuss this with our libraries and also have this recorded, because many of them will be watching it after today's session. But my questions came from my experience in working in South Carolina under the Department of Labor. And as you know, Charleston, South Carolina has a large military Air Force base. And I used to have to help people who are considered hard to employ. And that was one of the hardest things when you were doing a lot of things only to find out about those requirements for discharge. And this is so wonderful to hear that your services at least has steps that will allow a consideration or a review, because I think you might know it's very almost heartbreaking to know someone is seeking services and might be turned away. So thank you for your work.
No problem,
Thanks,
Jason.
Jason.
I think it's extremely important because we found that the amount of services that some of these veterans who have dishonorable discharges really are extensive. So and really they're looking at homelessness and some other issues that they need to get into our system as quickly as possible. So we're trying to make sure those character discharge determinations are quickly placed through the process. Right now, if we do have a dishonorable veteran who needs to get in, we are looking at about a 2 to 3 week turnaround, depending on how busy those technicians are and the workload, which right now they are, but we're trying to get those done as quick as possible.
Thank you. That is really good to know, and especially probably dishonorable discharges. The rules have changed so much with certain things, why people were discharged, that probably you have to kind of relook at that anyway. So that's really good to hear. I appreciate that. I wanted to also let you know that Lynn said in a chat early on that she really appreciates the packet and that she said it was great. So kudos to you. And all of you have posted your contact info. Can we assume that that contact info is also in the packets on that call sheet as well?
I don't think Greg's is, and I don't think Rachel's is, but Morgana's is and mine is, and the eligibility office. Absolutely, those numbers are in there.
That's great. So then we can send, okay, good. And are there any other questions? And folks are welcome to turn on their mic and their camera if they want to ask questions in person, or raise your hand if you have additional questions. Oh, right, Greg, yours is not because you're relatively new. Yep. And Joy, thank you for posting the evaluation for today's workshop. If you wouldn't mind filling that out, we do look at those and they help us with our future programming as well. So I don't know if there are additional questions. It sounds as though this was a really good initial conversation, and there's a lot of potential for us to maybe continue this conversation and see how we can collaborate to really get the word out about services for veterans. And Jason, go ahead. Jason, did you raise your hand by accident?
Hello. One reason why I think this conversation is so timely is because my understanding, and I wish I actually had a link to the bill, there is a legislative bill, I think right now in our legislative session in Vermont, that is seeking to attract or some way promote Vermont to veterans. So you might have more persons coming in if this bill passes this year, or some promotional campaign to allow Vermont for veterans, is what I understand it. So just letting you know to look at that if it's a promotional campaign, but I did hear that that is something people are saying they are looking to do to make Vermont very, very friendly to veterans. And one reason was because I think Vermont is only one of 3 states that does not tax veterans benefits and retirements. Only 3 states in the country do that. So we'll see.
Yeah, the more the better. Thank you. So it sounds like looks like there aren't any more questions. And I think the bottom line here is you don't have to be an expert out in the libraries on veteran services. All you have to do is really, as usual, find the right person to refer to. And it sounds like everybody that's on this panel will take it from there and then get folks connected to the services that they need. So I thank you so much for being here and presenting. And we'll get the word out for you, and maybe we'll be able to collaborate a little bit more. So thank you for participating. Thank you for presenting, and have a wonderful day. Enjoy the sunshine.
Thank you very much.
Thank you all so much. Have a
Thank
wonderful
you.
day.
Thank you.
Thanks.